How these cuts could impact public health care and health in general. Let's bring in NBC News medical analyst Dr. Vin Gupta. Dr. Gupta, always great to see you. So we're seeing these cuts to thousands of workers in the Health and Human Services Department. It's also right in the middle, by the way, of this growing measles outbreak. Do you think cuts like this can impact response to situations like that? What worries you the most?
Absolutely, Savannah. We're seeing a few different things here. Number one, we're seeing that the comms are all being brought under Secretary Kennedy, and right now it's pretty distributed. NIH has their own comms, FDA has their own comms, CDC has their own comms, and now it's going to come under one individual. And there's going to be a lot of concerns here in terms of what does that actually look like in terms of independence of the agency to talk freely about the data and what's actually happening. And we saw here on Friday, last Friday, the head spokesperson of the CDC actually resigned because they didn't feel like the CDC was following the data, because they were trying to, follow the priorities of a secretary that might not actually be following the science. So there's a lot of concerns here about clear public health information and how we're communicating to the public.
So some critics say they want the CDC to return to its core focus, infectious diseases. On the face, that may not sound like a problem, but why does that concern you?
Joe, it's a good catchphrase, and exactly on your point, this on the surface, great. The problem here is that if you look at the top 10 causes of disease, of risk factors for illness in the United States, Joe, both back in 1990 and just as recently as the early 2020s, infectious disease does not top the top 10. And so that's when we think about, well, it's the Centers for Disease Control. It shouldn't focus just on infectious diseases. It doesn't focus just on infectious diseases. It focuses also on chronic disease, like high blood pressure, like diabetes, rightfully so, because that's what's actually impacting Americans. So what's going to happen about, the biggest killers of Americans across the country if they don't have a CDC looking out for what's actually impacting them? That's the question.
These cuts, they might generate savings in the short term, but how could all of this ultimately drive up healthcare costs, maybe, and then potentially could that damage the economy?
Absolutely. Prevention is ultimately the biggest value in healthcare. And what's going to happen here is, the former Secretary of Health and Human Services, Savannah, said, there's going to be real impacts to the most vulnerable, elderly, other programs there that actually help keep people out of the hospital. There's going to be impacts, no question, to things that are high quality care at lower cost, whether that's for people that are younger, keep them out of the hospital in the first place, or those that are healthy living or healthy aging at home. So yes, there's no question that we're going to see over time. To your point, we might see some short-term benefits in terms of cost reductions, just because we have 20,000 less people ultimately from where we started. But this is going to have real impacts on Americans.
All right, Dr. Vin Gupta, great to see you. Thank you so much.